Hi, I'm Lee Kelso, host of the Health Call Live radio hour. I am glad that you're here to meet a medical school professor, a cardiologist, who says that stem cells are one of the most remarkable advances in medicine in our lifetime. So what's going on, and how can we see these treatments be more widely used and more effective? He is the author of a new book called The Secret World of Stem Cell Therapy. He is Professor Dr. Ernst von Schwarz, and he joins us live from the Los Angeles area today. So that's pretty dramatic to say this is the most significant development in medicine in quite some time. Tell me more about that. Tell me more about what makes stem cells so important.
Well, we are shifting. The paradigm in medicine is shifting. What we are doing since centuries basically is what we would call reactive medicine, meaning we as physicians react to whatever brings a patient in, symptoms, damage of an organ, injuries. So we try to limit further damage, but we are not really repairing anything. And in the big and new field of what we call regenerative medicine, which includes stem cell therapy, we want to go one step further and we want to repair the damage. Instead of just reacting to the damage and what it caused, the consequences, we want to repair it, and by that restitute basically the status to what it was before the injury or the damage. And that's all about stem cell therapy.
So these stem cells are in my body today and performing that function now, right? But as we age, we have fewer and fewer of them. So how can I take advantage and increase the number of stem cells? Is that even possible?
Not really at this point. I mean, you are right. We have the stem cells within us, but those stem cells, Lee, as you know very well, of course, they lose quantity and quality and potency over time. So the older we get, the less potent stem cells are. So I give you an example. In utero, for example, when an embryo is built, if there is loss of a limb, of a leg, for example, in the first weeks, then thanks to the enormous potential of stem cells, the embryo is able to rebuild that entire extremity. But over time in utero, and then of course after birth, if that happens, that's not going to be replaced anymore. So that only works within the first weeks in utero. So even though we have stem cells, they are really not that potent to do what they are supposed to do, and that's repairing all the damage. To some degree they are, but over time, like I said, we lose that potency. So what we do in using stem cell therapy, and it's all, of course, in the frame of research and clinical trials right now, is we use outside application of stem cells, which we give to the patients in order to basically imitate what they are supposed to do in our bodies, meaning repairing the damage. So as an example, several studies have shown that if you inject stem cells directly in the heart during open heart surgery into the borderline of scar tissue, that stem cells, to some degree at least, are able to regenerate scar tissue, meaning they are able to build what we call cardiomyocytes, heart muscle cells, and by thus reduce scar tissue, and then subsequent to that improve damaged function of the heart. And that has been nicely shown in our own experiments in experimental animals 20 years ago, and that has been then, of course, shown in clinical studies. But having said that, we are not at a point where we can say, oh, let's do that for every patient right now. And there are several reasons for that. Number one is, of course, stem cell therapy is not FDA approved. And the reason why it's not FDA approved is because we still have a lot of open questions and we still don't have enough data. On the other hand, every single study which was ever published using stem cells, whether it's for heart disease, whether it's for arthritis in the knee, whether it's for Parkinson's disease, have shown benefits. But all those studies have relatively small numbers of patients, and they show great results, but there is no cure of any disease, but possibly improvement in the functional capacity.
So the purpose of your book is to really teach all of us consumers the ins and the outs of stem cell therapy, right? Because there are lots of organizations out there promoting stem cell for a wide variety of reasons, and basically many of them are a scam. So what can we reliably count on stem cells to do for us as they're used today?
Well, I'm glad you brought that up, Lee. I mean, the main reason for me to wrote the book is not, I'm not selling our own stem cell therapies. You know, I'm not a salesperson. The reason is really to be educational and to educate the public about what are really the facts. So I'll give you an example. If you do an internet search on a condition, let's say heart attack and stem cell therapy, you will find within 0.2 seconds, probably 10 million hits, right? Stem cell therapy for heart attacks. If you look at those hits on the internet, 99.99% of those is pure advertising, marketing material from companies who want to sell stem cells, whether it's in the US or all over the world, without any scientific data. Even though, and I'm the biggest proponent of stem cell therapy in the future, of course, and I'm involved and have been involved in the basic research studies and the clinical trials, even though we all believe it is the future of medicine, it's not at a point where we can widely say, oh, this is the right thing for everybody with a heart attack. Absolutely not. And the idea of the book is, of course, to educate the public and tell them, look, that's published, for example, with regard to treatment of heart attacks. X many studies have shown these and these results, and that's the benefits, the potential benefits, and that's the risks. But again, I'm completely against the false advertising, as many companies do, promising cures of diseases by a simple injection, promising people, oh, you just pay $30,000 for one injection and you don't have lupus anymore, or your Alzheimer's is improved. That is just not reality, and I would warn against that. On the other hand, I'm myself heavily involved in studies which don't fit the typical double-blind control pilot phase studies in large academic centers. For example, for patients with advanced stages of heart disease, heart failure. They don't fit in any academic study. They are too sick and too old, and many want to try something like stem cell therapy. I had at least 10 patients over the last, I would say, 7 to 8 years who were theoretically candidates for heart transplantation, but practically couldn't get it because oftentimes either they were too old or had multi-morbid conditions, were too frail for that, but wanted to try. And as long as basically you declare clearly this is experimental, we cannot make any promises, we still did it and followed those patients over years of interest, and we're writing that up, what I'm just saying right now as a scientific observational paper right now. They all had improvement of their symptoms. They all had improvement of their functional and physical capacity, but they did not have any change in the measurable strengths of their heart. But the quality of life was significantly improved, and that's important, of course, especially if you deal with patients who have incurable chronic diseases.
So walk me down the path of what treatments out there today appear to be effective. I am familiar with regenerative medicine clinics where they're doing bone marrow extraction. They spin out the stem cells and re-inject them into a damaged joint. Some patients say it's working, others are not. Does that sound like a valid procedure? Is that something we might want to put some faith in?
Well, it is done everywhere in the world in that way, and it's very effective. It's still not FDA approved. We don't do that anymore, by the way. We don't use the patient's own stem cells from a bone marrow aspiration or adipose tissue aspiration. We use donor cells, which is umbilical cord blood or placenta tissue, which is 5,000 times more potent than what you find in your bone marrow or in your adipose tissue. So that's allogenic. So that's not from the same patient, but that's from a donor, basically. But we figured out over the last 12, 15 years, basically, to avoid, of course, any antigen antibody production, any immune reactions by basically avoiding the cellular membrane. So it's not cells, it's just the contents of cells. But even this is done still in the frame of clinical studies. It's not widely used or accepted, or it's not paid by insurance companies. It's not FDA approved. But it does work. And I've been involved in many patients who had, for example, as you mentioned, injections in their knees, even in cases where you would have thought, well, that's bone and bone arthritis and too much degeneration. But keep in mind, stem cells have certain effects. And if I may, I just mention them briefly. Number one is they're anti-inflammatory. So if we inject them in a knee which is heavily inflamed, the anti-inflammatory effects reduce the pain. Patients feel better. Number two, they are angiogenetic, meaning they help to create new blood vessels, capillaries. It's called angiogenesis. And by creating new blood vessels, we improve the oxygen supply, the perfusion, the circulation of whatever damaged organ, whether it's a knee, a brain, a kidney, or a heart, or the skin. And you can see that, and by improved circulation, we can improve and foster the healing processes. And thirdly, there's some degree, as I mentioned earlier, of what we call regeneration. So if you put stem cells into heart tissue, for example, they might have the ability to develop into heart muscle cells. If we put them in the liver, they might have the ability to develop into hepatocytes, so liver cells. If we put them in the skin, they heal by becoming skin cells. And that has all been proven. So everybody who is actively involved in the research of stem cell therapy knows that this is a way to go. And there's a reason, Lee, why the biggest and most expensive companies in the world, Amazon, Google, Apple, spend hundreds and hundreds of millions of dollars since over the last 7 years in regenerative therapy research and stem cell research.
So where is this all going, and when are we going to see the day where these treatments are dependable, reliable, and widely available? What's that going to take to get there? Well,
it takes more studies. The issue is, of course, that for the clinical part, in order, for example, if someone wants to get a new drug on the market to treat a certain condition, that takes usually 10 years and $100 million. So there is no big pharma lobby, big pharma companies who support stem cell therapy. So there's not much money there in the research. It's all based on small donations or small grants. And that's why all the studies we are doing and everybody else is doing have relatively small numbers of patients. So there's a huge demand for financial support to conduct large-scale clinical trials. And that will take, if you want to do it in the right way, of course, that will take several years. So my anticipation is there's nothing will be approved on a larger scale within the next 10 or 15 years.
So what are we missing there? Could stem cells play a role in helping to fight back this explosion of Alzheimer's we're going to be seeing? That has huge societal benefit if we can make that happen. Is there a path?
Absolutely. I'm a strong believer in that. And we have seen that anecdotally in individual patients, of course. So what needs to happen is basically that we have to do off-label therapies, not FDA approved, considered experimental for patients, and then just use the data, analyze them scientifically and statistically, and test them basically compared to placebo or standard treatment. We did that recently. As an example, we published a study for a completely different condition, sexual dysfunction. Okay, so there have been some very small studies on sexual dysfunction and improvement of sexual dysfunction after stem cell injection. By the way, both men and women, but mainly men. And if you Google sexual dysfunction and stem cell research, you find tons of marketing stuff, but the total number of patients worldwide published on stem cell injection for sexual dysfunction was less than 100. And there's like 50 million advertisements out there on the net. So there's a huge discrepancy. So we did a study on approximately 40 patients with some historic controls. We had the patients as historic controls, and we had some placebo-controlled patients where we just did very simple things. We used established questionnaires like the International Index for Erectile Dysfunction, which is a scientific tool, and applied that before and 6 months after the stem cell injection. And every single patient in the treatment group had an improvement. No cure, but a significant improvement. And that was compared to before, but also compared to controls. So the only way to get to a point where we can use it broadly is either waiting for the large clinical trials or really collecting a lot of data now as we go, basically, from our own experience, and then analyze them scientifically and get them published.
So
as an example, if you look about stents in the heart, we use stents for heart attacks for 15 years before they were FDA approved. They were only approved for gallbladder ducts, but not for coronary arteries, but we still use them for almost 15 years before the FDA approved them.
Well, then help me out as a consumer. If I'm suffering, let's go back to the arthritis in the knee, and I'd really rather not have a replacement surgery. I don't want the implant. Guide me to the questions to ask. How do I find someone that's going to provide me a therapy that's likely to provide improvement? What do I look for?
Well, the easiest answer, Lee, to that is read the book. So it's all in the book. You have to ask the right questions. I mean, and there are several things. Number one is, of course, do some background research on the providers. I mean, I have seen the best and the worst in this field. I have seen a lot of charlatans offering stem cell therapies for a lot of money. Number two, you want to look also at the academic background. Did they publish in the field? Are they scientifically active? Do they know what they're talking about? And I give examples in the book where I basically played a patient and called different centers who offered stem cell therapies and asked certain questions which they had no clue what I was talking about. And I knew that, that's all BS, basically. They don't know what they're doing. They're just running a business, basically. They have no scientific background. And the other question, of course, is what kind of cells are you getting and where do they come from? There's companies, one, for example, in California, who has sold stem cell products all over the country. And 3 years ago, 18 patients all over the United States within a few months were admitted to hospitals with sepsis, with bacteremia, meaning bloodstream infections after they received that particular product from that particular company. And turned out that company, they don't have physicians, they don't have even chemists on their board, so in their laboratories. They're just bankers and business people who don't follow any hygienic regulations and just try to make a lot of money selling unclean products. The FDA shut them down, and like a month later, they opened under a different name. And these are the things, of course, only an insider can know and would know. So you have to be really, really careful. And that's why I try to at least be as specific in the book what question to ask. But these are the main things people want to look in before they trust someone.
I have a great interest and a real focus on treating aging as a disease and extending our health span, not necessarily lifespan, but our health span. What role do you think stem cells could play in that effort?
A huge role. I completely agree with you. Aging might be a great thing from an ethical point of view, of course, but on the other hand, Lee, I completely agree with you. Aging can be a disease, and more people die of advanced age than of anything else. And age is the number one risk factor for death. And every day, 100,000 people die of advanced ages. So, of course, nowadays we have to see aging as something which is not a good thing, but which can be not prevented, but probably delayed. And regenerative therapy, including stem cell therapy, plays a major role. I give you an example. I'm in Los Angeles, as you know. What do you think why people on the red carpet in Hollywood or on camera look so flawless and beautiful and 20 years younger?
Are you going to tell me they're having facial injections? Are we having facial injections? Yeah.
We do stem cell injections in the face because it does rejuvenate the superficial skin layers. It improves the circulation, as I mentioned earlier. And within 2 days, they glow. I mean, it makes you look younger and subsequently feel younger. So, but besides that cosmetic and wellness aspect, of course, I mean, we have lots of data now, as you mentioned before, how we can treat arthritis. And if we don't treat arthritis, that leads to immobility, for example, and that leads to frailty, and that leads to more problems with aging. So there is a significant potency using regenerative therapy, including stem cells, to fight the consequences. I don't believe in a biologic immortality. I don't believe in the fact that we can prevent aging, even though a lot of people work now on a cellular level, how to try to manipulate the biochemical pathways leading to senescence, meaning cellular aging. But I'm convinced that within probably the next 5 or 10 years, we'll make a lot of advances in delaying the processes of aging. And as you said, Lee, exactly, we want to not just have people live longer, we want to increase the health span, not the lifespan only.
Have you treated yourself with stem cells for any reason, and what were the results if you have?
All the time, of course.
Well, tell me, how are you using them? Yeah. Is that why you have such a great head of hair?
No, I mean, I had, for example, not that long ago, I had a horrible shoulder pain, and I had an MRI of my neck, and I had some degenerative disease in my neck, and I went to 2 spinal surgeons. They said, well, you have a compression of the nerves and you need surgery. And I really didn't want to have surgery because it would take me out for days, if not weeks, of course. So I had actually one of my colleagues, and I was very uncomfortable. I mean, I couldn't move my left arm. I was in constant pain. There was no position which gave me any relief. If I lifted the arm up, it was the same down. I couldn't really sleep at night. It was just from that nerve compression. It was a horrible feeling. It really limited me in everything. And they gave me NSAIDs, like anti-inflammatory medications. Didn't do anything except causing some stomach pain. And I had then a single injection of stem cells all over the neck and the shoulder done by one of my colleagues. It was actually a student who came from Germany and worked with me on stem cell research. And within a day, basically, I was improved, and knock on wood somewhere, that's like a year almost ago, I haven't had any recurrence. I know that I do have degeneration in the neck, and at one point I might need a surgical repair. I'm aware of that, but I mean, for over or almost a year now, I'm completely pain-free.
So how do I, as a consumer, evaluate the potential benefit against the cost of these procedures? Because we're talking thousands of dollars for these procedures in many cases, correct?
Well, stem cells are expensive, and it depends, of course, on the lab. But overall, yeah, I mean, we have our own lab, for example. The cells cost a few $1,000s. Plus, we need to pay a technician and someone who injects and so on. Yeah, I mean, again, there's no insurance company who pays for it right now. And, I mean, we have a lot of people coming to us actually from all over the world for different conditions, and they ask about it. And, well, I tell everybody it is considered experimental. We have seen anecdotally great results. We have preliminary studies with great results depending on conditions. But there's conditions where I would not go that route. For example, in the whole field of cancer therapy, I'm a cardiologist, so I'm not an oncologist. That's not my expertise at all. And I was asked just recently several times on patients from all over the world about advanced stages of cancer and whether I think stem cell therapy could help. I personally have no experience in that. I would even stay away from it. because there's always a risk. Can you make things worse? So if someone has active cancer, I personally, at this point in time, I wouldn't go that route. But other than that, I mean, it's always a personal decision. If you want to undergo an experimental therapy, what is there to lose? The only thing you lose basically is the money. You have to pay for it in several institutions, unless you're lucky enough to go into a randomized controlled study where it might be free, but they're very rare, of course. We did several of them. We did a COVID study, which we self-financed. Basically, patients didn't have to pay for it, with also amazing results, but it was a very small number study.
Leave me with the thought here. What, as a consumer, I mean, your book is very easy to read. I found it not to be at all intimidating, and I'm sure most people won't. What is it you want me to know, and how do I look at this in the next 3 to 5 years?
I want you to know that stem cells is the future of medicine, and there's a lot more to come. Watch in the news, but don't believe everything you read on Google.
All right, that's a good place to leave it. That is Dr. Ernst von Schwarz. He is the author of The Secret World of Stem Cell Therapy, and I think you'll find this to be a very interesting read. Doctor, thank you for joining us.
Thank you very much, Lee. Good luck to you.